Hello, I'm Chris Muckler. I'm a certified registered nurse anesthetist, and I would like to speak with you today regarding the new government guidelines on mammograms. According to the American Cancer Society, the second leading cause of cancer deaths among women is breast cancer. Mammograms revolutionized breast cancer detection and played a major role in decreasing the incidence of the disease.
It was a very aggressive cancer. I had to have 4 treatments of adriamycin and cytoxin, followed by 12 treatments of Taxol, 33 radiation treatments. Then I did a prophylactic mastectomy on the other side. Risk of cancer rises systemically or very drastically between the 30s and the 50s.
About 6 to 8 months after my sister Regina was diagnosed, I was being followed at Duke University for just basic, high risk, and they just gave me just a simple test of needle aspiration, and that came back with dysplasia in both of my breasts. So, in 2008, in December of 2008, I had elected to have bilateral prophylactic mastectomies with reconstruction.
My name's Debbie. I'm a nurse, been a nurse for 30 some years. I'm also a breast cancer survivor. Had breast cancer 6 years ago, had a mastectomy, and have done great since then. But I take care of a lot of patients that have had mastectomies, and I try to do a lot of education with them. One of the things I really am adamant about is screening for breast cancer and getting your mammograms on time and doing self-examinations to prevent people from having breast cancer. What happened to me, and even though I'm a nurse, I had a mammogram that showed a spot on my breast, and I was told that was probably benign, we were going to watch it for 6 months. It was small, it seemed insignificant, and I did that. Just didn't question, just did that. And then 6 months later went back for a follow-up mammogram, and the spot had grown, and then there was another spot with it. So I ended up with 2 different types of cancer. Whether that could have been prevented had I had something done earlier, I don't know, but I ended up having to have a mastectomy. And I did some follow-up chemo, and I'm doing fine now. But however, there are so many people out there that don't realize that you have the right to say, can we have this checked now? You don't have to wait 3 months, 6 months, or even a year. That you have the right, or it's actually a privilege to go to your doctor and say, I want this checked out now. I don't feel comfortable waiting. Or even if you don't agree with what your doctor says, you can go to another doctor and say, get another opinion. That's your right as a patient and as a person.
It's not so important to do self breast examination every month. Let me tell you, it is important every single month because that buys you, the sooner you catch it, the faster they can fix it, the less impact you have in terms of whether it's localized or systemic when it's already spread to your lymph nodes. I went through 16 chemotherapy treatments. I've had 7 operations, which included, because it was an estrogen-based cancer, a oophorectomy, which basically they take your ovaries out, so that sends you into full-blown menopause. So not only are you crazy from the chemo and the steroids that they put you on, but you're going through full-blown hot flashes and everything. And on top of that, I've had the 33 radiation treatments to both my breast and as well as my neck area because they wanted to make sure that it didn't spread. And to go in there and sit in there and have death like right there staring you in the face is the most unfeminine, scary thing because we all know we're going to die, but it's you get that second notice in the mail. So if you can do anything for yourself, take away from this video, that tonight I'm going to go home and do my breast self-exam. I may listen to somebody that has an opinion about 3 years going to have a mammogram, but that's an opinion based upon some stat that doesn't include yourself or your family. So therefore, you should only listen to that. But if you feel a lump, you feel any pain, you should listen to what your mind is telling you and be very aggressive, because either you can be aggressive or you can let the cancer be aggressive. It's your decision to make.
Although I am in no way suggesting that you leave your healthcare provider out of this decision, the intent of this video is to emphasize the importance of self-educating, evaluating your own risk factors, and making a choice that's right for you, your body, and your future. Weigh the risks and the benefits that mammography has to offer. Consider that 1 in 78 women can expect to develop breast cancer at some point in their life. By age 40, an estimated 1 in 68 will develop breast cancer. And by age 50, the incidence narrows to 1 in 37. Is waiting until you're 50 worth it? That's a choice you'll have to make. Thank you for your time.